Surgery you may see lots of adverts for is often touted and historically was thought of as the only real solution for snoring. Unfortunately, that's not the case. These days it's recognised by most ENT surgeons that they might be able to do something to help improve the situation for a snorer when using a mandibular repositioning device, or improve their ability to comply and use PAP successfully. But as a solution on its own, no, not really. So nasal surgery, well, it's really a cure, because if the problem is a nasal valve, well then sure, that may help. But if the problem is oropharyngeal or hypopharyngeal, operating on the patients in the nasal cavity, removing polyps and this sort of thing, it's kind of missing the point. If anything, it's maybe making an echo chamber. No, so nasal surgery sometimes is justified because we're improving the patient's conscious airway, but no, it's missing the point. Now, here's a lovely long-sounding word: uvulopalatopharyngoplasty, or UPPP, or sometimes UVPP. It's removal of the uvula and portions of the soft palate. Said to be 40% successful for patients with an AHI below 20. It's all down to the diagnostic technique. If the soft palate is the villain of the piece, and that's the problem, well then yes, your chances of success improve. If you have, as I showed you earlier on, some tremendously long uvulas and tonsils and adenoids and floppy or large pharyngeal walls, well then certainly it's going to improve things. But it's definitely a case of it's about the diagnosis and actually getting the diagnosis right before they start wading in and chopping off the dangly bits. Now, you may also have heard of LAUP, or LAUP, or laser assisted uvulopalatoplasty, or uvulopalatoplasty. It's losing favour because it's about scarring. It's because what we're trying to do with the laser is to tension the soft palate or keratinize through scarring. It needs repeated treatments, and then there's what they call radiofrequency ablation, so effectively microwaving the tissue and again trying to keratinize and stiffen the soft tissue. Next one would be maxillofacial surgery. So this is really kind of getting to the severe end of the scale. This would be maxillary and mandibular advancement. You would only really want to do this if the individual had a need more than just their snoring and apnea. It's going to change the way they look. It needs to be really emphasized to the patient that they will have a totally different facial appearance. Sometimes it comes as a surprise, which is disappointment. And then there's perhaps the genioglossal advancement to tension the hyoid, or there's hyoid suspension. There are ways of actually bringing the hyoid bone forward without actually changing the face. So it's detaching and then turning through 90 degrees and reattaching on the inside of the mandible. And then there's of course the last option, which is a tracheostomy for a severe and unresponsive case. Just bypass the area altogether. Not something that can be thought of lightly. Okay, here we go then. There's an image of a UPPP post result. And there we go, you can see sort of an illustration. Barbarically painful operation. Yes.